So sometimes the blood pressure becomes so high that the person is entering into what we refer to as hypertensive crisis. This occurs most often with a history of hypertension that our patients are non-compliant with their medications. It's a severe elevation in blood pressure, greater than 180 systolic over 120 diastolic. And the worry here is that target organ damage is occurring, because remember, we said that when the blood pressure is too high, the organs are not being properly perfused. So hypertensive crisis, also known as malignant hypertension, occurs when hypertension is severe enough to cause acute visual changes such as blurred vision or neurologic symptoms, and maybe the patient is having a stroke or a hemorrhage. Neurologic symptoms may include poor pupil reflexes and weakness on one side of the body. We're also worried about organ damage at this point, because remember, we said before that when the blood pressure is too high, the organs are not being perfused properly. So if the hypertensive crisis does not get intervened upon, patients can become nauseous, they can have a headache, vomiting can occur, the patient can become confused, and even have seizures and go into a coma. So, if this occurs, there are treatments. And what we would do is, in a clinical setting, we would give vasodilators IV. And this would cause arterial vasodilation. Sodium nitroprusside and nitroglycerin are two examples of direct vasodilators. If we had a patient in the clinical setting that was having hypertensive crisis, the nursing responsibilities would be to monitor the vital signs, watch for hypotension, and make sure we are checking neurological assessments, because we're worried about blood supply to the brain. The patient will generally be on bed rest. We will have strict measurements of the intake and the output, again because we're worried about perfusion to the kidneys. And we will monitor the heart on telemetry. And we will have focused cardiac and respiratory assessment, monitoring both the lungs and the heart. Next, we're going to talk about orthostatic hypotension. Orthostatic blood pressures measure the blood pressure with the patient in these three positions: lying, standing, and sitting. First, we measure the patient's blood pressure while they're lying down, then we measure it while they're sitting up at the bedside, and finally we measure the blood pressure again with the patient standing. It's always important to know the baseline blood pressure as well. So, from lying to standing, if the systolic blood pressure decreases more than 20 millimeters of mercury from the lying to the standing position, it is considered a significant finding. If the heart rate increases by 20 beats per minute or the patient becomes tachycardic, this is also significant. So what happens in orthostatic hypotension? There is inadequate peripheral vasoconstriction in the arterioles and the veins, and this causes venous pooling of the blood. So it decreases the cardiac output. The brain does not get enough blood, low blood pressure results, and lightheadedness may result. So what causes orthostatic hypotension? Well, medications can cause it, especially antihypertensives like alpha blockers. Cardura is an example. Vasodilators also can cause orthostatic hypotension. Nitroglycerin is an example of a vasodilator, and diuretics such as Lasix. Other causes may include prolonged bed rest. If there's any internal bleeding, for example, if a patient has a GI bleed, or in the case of vomiting and diarrhea. So what are we going to do? We're going to have the patient sit back down. Usually this resolves when the patient returns to a sitting or lying position. We want to dangle the feet before standing the patient. We want to get them up slowly. Sometimes compression stockings, referred to as TED hose, can help, and also increasing fluid intake if the patient is dehydrated. We also want to review medications. We want to find out if the patient is taking any new medications, and we also want to find out if they are taking the correct dose of medication.